Hi there, my name is Aimee Schaefer. I am a current physician in training at St. George's University, and today I would like to talk to you about cat scratch disease, or CSD. Now, I'm presuming just in finding this video that some of you may be concerned for exposures to CSD, so why don't we first take a look at transmission of the disease. So naturally, the cat is the most common vector for CSD. Note that in science, we use the term vector just to describe kind of a carrier. So you can think of the cat as like a mailman that is bringing you a type of parcel. And in this case, that parcel is a bacteria. Now, although the cat is the most common vector, this bacteria has been noted to be carried in horses, pigs, dogs, and even whales. So this is a photo of the bacteria that actually causes CSD. It is called Bartonella, and this is basically a genus which includes multiple species that all cause kind of the same sense of symptoms. Bartonella is transmitted via bites, scratches, or has even been documented to be transmitted via saliva. So if a cat licks an open wound on your body, that may cause CSD. So what can you expect once you've been bitten or scratched? Two typical symptoms predominate the presentation of this disease. One you'll see here is these lesions that most often present at what we call the inoculation site, essentially where you were bit. And also persons typically experience solitary lymphadenopathy. Lymphadenopathy is just a fancy term for a swollen lymph node. So say, for instance, you are bit on your left hand, you might later develop some swelling on your left neck or your left armpit. Also, common symptoms for CSD include fever, kind of just feeling not well overall, malaise, fatigue, and sometimes rarely persons have been known to experience headache, nausea, vomiting, or even acute anorexia. The good news is that most cases of CSD are rather self-limiting. Typically, within a few weeks, the lesions, the lymphadenopathy will resolve themselves. However, for some people, if you do visit your primary care physician for the symptoms, they may want to see you in follow-up within 2 to 3 months to make sure some of that swelling has gone down. Typically, if it hasn't, a mild antibiotic can resolve that issue. However, CSD can be more insidious, and sometimes associated diseases will develop that require some of these antibiotics listed here, including rifampin and Cipro. So why don't we take a look at these associated diseases? Possibly the two most common are known as paranoid oculoglandular syndrome and neuroretinitis. They sound scary, but they are far less so. Typically for persons, this just means kind of some eye redness, a bit of discomfort, some swelling around the eye, and then at times some discharge from the eye. Again, much like CSD, these two infections are relatively self-limiting, and these symptoms will most often clear up on their own. If not, your primary care provider can provide you with just a gentle eye drop with some mild antibiotic in it. However, there are 3 diseases which have been associated with CSD that are very lethal, and these include endocarditis, or essentially an infection of the heart valves, osteomyelitis, infection of the bone, and then encephalitis, which is swelling on the brain. So if you are a person who has had a recent exposure, has the lymphadenopathy and those lesions, and has, for instance, a persistent fever or headaches that just are not going away, you really do want to seek follow-up. Now, who's most at risk for developing CSD? Essentially, anyone who owns a house cat or has regular exposure to these animals. Also, notably, persons who have immune systems that just are not the greatest. So persons who have maybe had a transplant, or children, the elderly. Essentially, they want to be especially careful when dealing with some of these animals. Now, if you think you have CSD, please go to your doctor. Blood testing can be performed. This is the most common form of confirmation. A small culture will be grown with your blood, and within 2 to 3 days, your physician can call you at follow-up and either confirm or deny the presence of Bartonella. Also, a fun test known as an ELISA can be performed, whereby antibodies are used to actually identify that bacteria in your system. And in some of those more severe cases, like the endocarditis, the osteomyelitis that we talked about, your doctor may even want to do a biopsy on one of those lymph nodes to really make sure that they're getting the correct treatment for you. Finally, how can we avoid cat scratch disease entirely? The main form of preventive measure is going to be extremely good hygiene if you are bitten, scratched, or licked by any cat. So really thoroughly wash that affected area. Make sure that the bacteria are given time and resources to breed in your skin. Also, you can try certain measures with your own cat, such as declawing, or making sure their teeth are an appropriate length, giving them nice things to chew on. And one other thing to note is that fleas are a very common vector of Bartonella as well. So if you can limit essentially cat-to-cat contact where fleas are bouncing around, and also use those medications recommended by your veterinarian for flea control with your house cat, these are all very good preventive measures to ensure that you don't develop, or your loved ones, cat scratch disease. I would like to thank you for your time today, and good luck.